as it relates to pharmacogenomics and transplant. So we know, there's been past evidence that was used to support this project, showing that aggressive symptom management and supportive care acutely leads to better quality of life for transplant patients. So that was kind of an underlying basis, and then we're expanding on that with the PGX element to see if there is a specific vehicle that we can use to aggressively support, provide supportive care. Where pharmacists really play a role is, pharmacists generally should be considered medication experts, while PGX is still not broadly emphasized. I think pharmacists and onc-pharmacists in particular, including transplant pharmacists, have a general familiarity with PGX. There's a lot of interest in the pharmacist community around the use of PGX to manage patients. In oncology specifically, we have seen PGX apply to other malignancies, mostly solid tumors. And so, within transplant, pharmacists have the opportunity to, pharmacists are often engaged very heavily in the general symptom management and supportive care for patients. Also engaged in therapeutic drug monitoring, as it pertains to tacrolimus, voriconazole, among other azoles, in particular. And so these are impacted by, or are, and maybe in the future, impacted by these polymorphisms. So pharmacists have the opportunity to interpret these such results, and then help direct the team, or really be the leader in directing the team to apply these results right now to supportive care and symptom management. There is research ongoing looking at such information as it applies to chemotherapy, including chemo used in preparatory regimens and whatnot. So I really think pharmacists do, again, as medication experts for the team, can have a really strong role in the interpretation and application of PGX results in transplant patients. And actually, within our study, so it's pharmacists offering the review of PGX, dropping notes at the beginning of transplant, as well as critical time points. So day 30, 60, 100, pharmacists are reviewing medication lists, dropping and noting opportunities for adjusting current medications, as well as opportunities for interpreting symptoms, that are identified on symptoms, symptoms assessment, and then, offering recommendations based on the PGX panel for patient, panel and results for patients. So part of the design of our study too is to develop the role of pharmacists in utilizing PGX in practice. So I think that's one element. And obviously, we have clinical pharmacists who are directly in clinic, who are using these results, who maybe use these results to manage, for our clinic, voriconazole and tacrolimus, like I said. We're utilizing specialty pharmacists in a remote or virtual way to help with review and provide recommendations and whatnot. So kind of we're kind of utilizing a few different practice settings that we hope to show a benefit with. And that's kind of how this relates to a few key areas where pharmacists are particularly involved in transplant care.